Artificial intelligence and companion animal medicine. Is it here? It most certainly is. So what is it, where is it, and what do you need to know about it? I'm Dr. Cath Watson, and this is the PD Pet Care Vlogs. So is AI currently in use in companion animal medicine? Absolutely, and possibly in the areas you haven't actually even thought about. I was interested to hear that in the States there's over 200 approved AI applications for medical use already. So that's an awful lot, and I don't think I could sit here and even name probably 10 of those. But some of the stuff that maybe you haven't thought of is particularly around image processing. So in our software that we're using for digital radiography now, for ultrasound machines, and even for more advanced imaging. So being able to bring all that data or lift all that data off the receiver, whether that's a plate or some other form of capture, it is artificial intelligence that's actually assessing all that data, pulling it together, and able to provide you with an image for you to interpret. And in some cases there's some software now that is actually able to start interpreting some of those images produced as well, so taking out some of the role of the radiologist. There's also obviously the one everybody knows about is ChatGPT, and this is being commonly used to write client communications, articles for distribution, social media posts, that sort of thing. There's also dictation software, which is also obviously AI, so able to transcribe what you are saying into a written clinical notes. So what about future uses of AI? There's a bunch of different potential uses for AI in the future, and some of these are not very far away or actually are already starting to be used. So in the clinical realm, first up is prediction and prevention of disease. So I think it's not unrealistic to expect that in the future we will be able to get a pretty good idea of what the risks are for potentially individual animals based on their genetics, and that might be due to gene tests. It might be because the parents' genomes are known or the full genomes are known. So individual risks to certain disease. In some respects, some of that's already here, but being able to plug that data in and get an individual animal risk profile is certainly not that far away. But also, as far as prevention of disease, understanding what the triggers are for an outbreak, what the geographic spread of that is likely to be, are there particular animals that are going to be at higher risk. So all that sort of modelling, we've seen a fair chunk of it through COVID, but it's not it's not unreasonable to expect that that's going to be across a wide range of diseases. And that hopefully is going to help us prepare better for things like outbreaks as well. So I've talked about imaging, and like I say, already we're starting to see some imaging software that's helping to interpret what we're seeing on that, or what is showing on that image. Still requires some human oversight, but over time I think with more and more machine learning they're going to get better and better at actually picking up some of this, particularly the more subtle stuff that clinicians in a rush are likely to miss. Unless you go back and review those radiographs when you've got a wee bit more time. But not just image processing. There's also, for cytology, histopathology, being able to train a machine to review multiple slides, multiple slices of cancer tissue and so on, to actually be able to give a diagnosis. There is absolutely no reason that machine learning is not going to be able to not only help provide a diagnosis, but also be able to collate a lot more data from a single lump or aspirate to give a much broader picture of what's going on. Also things like gait analysis, so having a machine being able to interpret video clips, stills, to analyse which leg is affected, which joint is affected, and be able to narrow down those diagnostic fields much better. So there's a huge amount of potential there. As far as treatment goes, obviously being able to monitor how patients are doing and personalised treatment programs, and the obvious ones that spring to mind here would be epilepsy and diabetes mellitus. Obviously we can get a reasonable amount of information, but be able to predict when there's going to be issues, or to be able to recommend what the best treatment plan is for those animals based on the symptoms they're showing and the blood work and that sort of stuff that's come back. As far as prognostic, particularly for acute abdomen that's going to surgery, being able to give a prognosis as to what the likely outcome of that surgery is before you go in. We as humans are good at processing that stuff, but perhaps not as quickly as we could. So being able to put in all the data and then have a very obvious outcome to be able to present to a client before the decision is made to go to surgery or not, it's going to make, hopefully, decisions much easier. Finally, on the clinical side is research. AI has the potential, just like the histopath in cytology, the ability to analyse huge volumes of data in a very short period of time means that we can analyse much larger data sets, but also bring in more variables without having to obviously spend huge amounts of time as individual humans to go through all that stuff, but also really good at pattern recognition. Also good for predictive tools, should help reduce some of the animal testing because there can be a lot more animal modelling done instead, but also One Health modelling. So this would be looking at stuff that's happening in the animal world that might transfer to humans, or stuff in humans that might transfer to animals. So one of those interesting areas is expressions around pain, whether they transfer between humans and dogs and cats and sheep and so on. So computers are really good at picking up a lot of those subtle things that, as humans we often have some bias there in terms of what we want to see, whereas machines don't have that bias. As far as non-clinical stuff goes, well, obviously there's all those operational efficiencies, whether it's your online booking system, whether it's triaging calls. There's a lot of potential in the future there, and again, some of that's already happening. But also around education, and this is something I hadn't really considered, but obviously you're going to be able to have a much more individualised education plan, but also there's huge cost efficiencies, particularly for lower income countries where access to training is not so good, because we've got things like virtual reality where we can train using tools over the internet rather than actually physically having to be there. So there's a bunch of other things that we also need to be considering, not just what AI can be used for, and I think this is particularly important to consider. Look into the future, what AI can actually do for us, but also what do we need to do to ensure that AI is actually going to deliver what we expect and in a safe way. So one of those is around data security. Who has actually got access to that data? How private is it? Where is it being stored? So we need to be able to answer those questions and understand the answers, and I think that's the big thing. It's all very well asking the question. If you don't understand the answer, you need to dig further in so that you do. One of the big considerations is around ethics. So if we are using AI tools to help us make diagnostic treatment plans, prognostic information, that sort of thing, and if we get it wrong, who's to blame? Or if there's a poor outcome, who's actually responsible for those decisions, for that information along the way? Is it going to be solely shouldered by the clinician, or actually the AI developers also going to have some level of responsibility in there? So ethics is always a tricky area because there's often no black and white answer, but I think that's something we do need to start thinking about now. As far as access, obviously as any technology develops, then often there's more and more access to it as things advance. So are the public going to have access to medical tools? Probably not immediately that they're developed, but down the track, why not? So how is that going to change our role as far as advisors and clinicians, essentially? What's the purpose of the AI? So particularly working within the sphere of animals, are we going to be focused on welfare or production? And while they're not completely mutually exclusive, they do have different focuses. So I think we need to be really clear that what is the purpose of the AI? Is this actually going to improve the animal's life, or is it going to improve their output, and can we do both? And is there justification for the outcomes? Just because we can do something, should we do it? And more importantly, if AI can help replace a task for humans, is there actually a reason for that task to be replaced? Or is it something that's actually still better done by humans for now? So having a face-to-face discussion with a client over euthanasia probably is always going to be done better by a human, because we've got that empathy, we can understand their emotions, and it's not going to be a computer standing there saying, well, this is the best, this is the right decision for a whole bunch of clinical reasons, without understanding the emotions that go behind it. The last things I want to talk about is regulations. They are different all around the world, so understanding what the restrictions are around AI wherever you happen to be practicing. This is not something I've done for New Zealand yet. I don't understand what our regulations are, but certainly listening to the Wasaba podcast is something I think we all need to go and investigate, because there are differences between the US and Europe, for starters. And then finally, can you trust the company that is producing the AI? Whatever tool it is for, is this a company that has a good long history of doing stuff that benefits us in our work? Is it a startup company that's got that appears to have good ethics, and is it a company that has strong values that you agree with, or do they have a bit of a dodgy history of trial and error and actually half the stuff doesn't work? So are you comfortable trusting the AI that's coming in? Do you even understand that it's AI? So I think I've certainly had my eyes opened to not only what is AI, because I hadn't really considered some of that stuff before, but also what the potential use is, but also understanding what the risks and the questions I should be asking.